Opioids and sedative hypnotics. This is chapter 4. Um, wow, this is a tough one. So let's go ahead and get started. Depressants depress the activity of the central nervous system. Hence the name depressants. They sedate, they cause muscles to relax, they may depress inhibition, such as your emotions and your impulses. They mimic natural inhibitory neurotransmitters, such as endorphins, enkephalins, and gamma-aminobutyric acid, or GABA. Three major classes of downers, opiates, opioids, sedative hypnotics, and alcohol. Four minor classes of depressants, skeletal muscle relaxants, antihistamines, over-the-counter depressants, and look-alike depressants. There's a separate chapter about alcohol, but the rest we're going to talk about. Opiates, opioids include opium, morphine, codeine, hydrocodone. Another name for hydrocodone is Vicodin. Oxycodone, another name Oxycontin. Methadone, and heroin. Originally developed as painkillers and cough suppressants and diarrhea treatments. Sedative hypnotic synthetic chemicals developed to treat anxiety and insomnia. It includes neprobamate, also known as Miltown, phenobarbital, seconal, Doradin, methaqualone, also known as Quaaludes, flunitrazepam, also known as Rohypnol, or the date rape drug, GHB, and benzodiazepines, which include Xanax and Valium. Alcohol is a natural byproduct of the fermentation process of plant sugars, or starches. This is the oldest psychoactive substance used by humans. Alcohol is the world's second most destructive drug after tobacco. Skeletal muscle relaxants, synthetically developed central nervous system depressants that target the area of the brain responsible for muscle coordination and activity. This would include Soma, Paraffin Forte, Flexeril, Lioresal, and Robaxin. Antihistamines are found in cold and allergy medications to block the neurotransmitter histamine. Synthetic drugs used to treat allergic reactions, prevent ulcers, prevent shock, prevent rashes, prevent motion sickness, prevent symptoms of Parkinson's disease. Over-the-counter depressants, sleep aids or sedatives, they include things such as Nytol, Sleepies, and Sominex. The active ingredients in these over-the-counter sleep aids, scopolamine, antihistamines, bromide derivatives, and alcohol. Look-alike depressants are rarely seen today, so we won't really talk about them. Opiates are products of the opium poppy. Opiates are synthetic versions of the opiates. Opiates come from the milky sap that oozes from the unripe seed pod of the flower, and this is what it looks like as it oozes. It will ooze for about a week. It can be milked about 6 times in any given season. Opium produces over 25 alkaloids. The two most important are codeine and morphine. Codeine makes up 0.7% to 2.5% of the opium exudate. Morphine makes up 10 to 20% of the opium exudate. A third alkaloid that is a stimulant rather than a depressant is thebaine. Semi-synthetic opiates are opiates that are refined in a select way to produce a psychoactive substance that is partially natural and partially synthetic. These include heroin, hydrocodone, as we said, Vicodin, oxycodone, Percodan, and other names, Percodan and Oxycontin, and hydromorphine, another name being Dilaudid. Having worked in medicine, I know them mostly by the other names, Vicodin, Percodan, Dilaudid. Fully synthetic opiate drugs, methadone, meperidine, another name for that is Demerol, and propoxyphene or Darvon. synthetic opioid antagonists, naltrexone and naloxone. Opium poppies were first cultivated in ancient Mesopotamia. It then spread north to Greece and west to Egypt, eventually making its way east into Asia. Opium was used in many medicines in the Old World, but its ills were seen even then when various writers wrote of its addictive properties. Opium tended to be used as an additive, eaten, chewed, or mixed with liquids and drunk. In the early 1500s, opium regained popularity when the Swiss chemist Paracelsus began making a tincture. Anything that's a tincture is mixed with alcohol. It uses alcohol as its liquid substance with the opium powder, and he made a substance known as laudanum, which is a mixture of opium and alcohol. He used laudanum to treat dysentery, pain, diarrhea, and coughs. Opium continued to be used in medicinal mixtures for the next 3 centuries. Paregoric, tincture of opium with camphor, was developed for the treatment of diarrhea. This mixture is still used today. As a matter of fact, when my mother was suffering from gallbladder disease and had some fairly disruptive diarrhea, she was given paregoric. This was back in the 50s. Opium smoking became popular in the 16th century. This means of drug introduction puts more of the active ingredients in the system faster, in about 7 to 10 seconds. Because the psychoactive ingredients enter the bloodstream and brain faster, there is a greater sense of euphoria, well-being, and relaxation. Modern methods of smoking heroin involves heating the substance in tinfoil and inhaling the fumes through a straw. And this is known, of course, as chasing the dragon, and that's what it looks like, chasing the dragon. In 1805, the morphine alkaloid was first isolated from opium and was found to be 10 times stronger than opium and thus a more effective painkiller. Morphine was first used in the Crimean War from 1853 to 1856 between Russia and England, and then during the American Civil War. Opium poppies were actually grown in the South to provide morphine for the Confederate troops. In 1832, the weaker alkaloid codeine was isolated from opium. It was found to only be twice as strong a painkiller as opium. Codeine was used to treat coughs and general neuralgia. In 1874, a British chemist boiled morphine with acetic anhydride to create an opiate synthetic that was 5 to 8 times stronger than morphine. Bayer Pharmaceuticals of Germany bought the chemical and named it heroin. Its effects were heroic on the individual. Bayer marketed it as a cough suppressant, a chest painkiller, and a treatment for tuberculosis and pneumonia. Heroin crossed the blood-brain barrier more rapidly than morphine. The result was a more intense and rapid rush and euphoria. It is estimated that at the turn of the 20th century, there were between 250,000 to 1 million morphine and heroin addicts in the United States. Through the 1800s, patent medicines were produced that contained opiates. These patent medicines were used for such problems as tired blood, colicky babies, coughs, diarrhea, and toothaches. They were used to quiet loud children and to aid in sleeping. Surprisingly, surveys showed that more than half the opium addicts were women. 56 to 71% of all the opium addicts were actually women from these patented medicines. Famous opiate addicts of the 19th century: Jane Addams, the first social worker, Sarah Bernhardt, who was an actress, Elizabeth Barrett Browning, who was a poet, Charlotte Bronte, who was an author, Louisa May Alcott, another author, Samuel Coleridge, a poet, Charles Baudelaire, who was an author and a poet, Lord Byron, who was also a poet, John Keats, another poet. Edgar Allan Poe, an author. He wrote the Raven. Algernon Swinburne, who was another author. Opium, morphine, and heroin became a health concern in the United States around the turn of the 20th century. In 1906, the Pure Food and Drug Act was passed, limiting the manufacture and use of opiates. In 1914, opiates became the first drug considered narcotic in the Harrison Narcotics Act. In 1924, heroin production was outlawed in the United States. In 1915, only 63 of the people incarcerated in federal prisons were incarcerated for narcotics violations. By 1928, 1 out of every 3 people were incarcerated because of narcotics violations, about 2,529 prisoners. By 2004, 86.5% of the federally incarcerated prisoners had been convicted on drug offenses. 155,900 prisoners out of 180,328. Because of the market for opiates in the United States, criminal organizations sprung up to supply the demand. The Chinese triads, the mafia, the French connection, the Mexican narcotraficantes, African traffickers, Russian mafia, and the Colombian cartel. And if you watch movies that deal with drugs, then you probably have seen all of these, especially the French connection, Mexican narcotraficantes, the mafia, of course, Russian mafia, Colombian cartels. Yeah, real popular. At present, 4.6 million Americans use opioids illicitly every month. Only 136,800 of these individuals are heroin users. 3.5 million people in the United States have tried heroin. The rest are prescription drug abusers, mostly OxyContin and Vicodin. A new wrinkle that is appearing in Dallas area junior and high schools is a substance that they refer to as cheese. It's a mixture of a little Mexican brown heroin and over-the-counter medications containing antihistamines. As you can see, it looks like mozzarella cheese, dry cheese that you put on your spaghetti. The mixture gives the individual a rush. Several deaths have caused a nationwide scare. And of course, these are children. Worldwide, 5 to 10 million people are regular heroin users. The United States only consumes about 3% of the heroin produced. The areas that are affected the most are Europe and Asia. 92% of the world's heroin is produced in Afghanistan. Most of the world's legal opium from pharmaceuticals is grown in India. Most of the heroin coming into the United States comes from Mexico. Medically, opioids are prescribed to deaden pain, control coughing, and to stop diarrhea. Non-medically, opioids are used to drown out emotional pain, get a rush, induce euphoria, and prevent withdrawal symptoms. Pain is transmitted to the central nervous system through the neurotransmitter substance P. The P, of course, doesn't stand for pain, it stands for peptide. The more substance P that is released in the synaptic cleft, the greater the pain. The body modulates the intensity of pain by blocking substance P receptor sites with endogenous painkillers, endorphins, enkephalins, and dynorphins. And this is one of the reasons why when you hurt yourself, sometimes it's a intense pain in the beginning, but then it becomes a dull pain later on, and that's because of the endorphins, enkephalins, and dynorphins, which are blocking the substance P. The endogenous painkillers occupy the substance P receptors, referred to as mu receptors, kappa receptors, delta receptors, and non-opioid sigma receptors. Exogenous opioids work because they occupy the opioid receptors, acting as if they were endogenous painkillers. Endogenous painkillers are also activated when an individual feels anxious. It decreases anxiety, it produces a sense of detachment, it makes the individual feel drowsy, it deadens the unwanted emotions. These effects occur because of the inhibiting effect of the endogenous or exogenous painkillers' effects on the locus coeruleus. Opiates, opioids induce pleasurable feelings by slotting into receptor sites meant for the endogenous painkillers, inhibiting the action of GABA, triggering glutamate receptors, enhancing dopamine neurons on the reward reinforcement pathway, and increasing the release and enhancing the effect of dopamine. Heroin has the strongest effect of all the opiates, opioids. The reward reinforcement pathway performs two functions. It signals pleasure so that the act is more likely to be repeated. It signals the alleviation of pain. Research has disclosed that relief of pain is a stronger incentive than the introduction of pleasure. With psychoactive drugs especially, opiates, opioids, the desire to prevent withdrawal symptoms is a stronger incentive for continued use than the desire for pleasure. When an individual is prescribed opiates, opioids, a non-abuser will use the medication until the pain relief threshold is found. An abuser will use beyond the pain relief threshold, searching for an emotional high. Chronic users of opiates, opioids will use a drug in excess to prevent the withdrawal symptoms. They are seeking to return to the normal state. Opiates and opioid-like receptor sites have different functions. Mu and sigma receptors trigger the reward reinforcement pathway, block pain transmission, change mood, cause pupil contraction, depress the autonomic nervous system, respiration, and blood pressure. Kappa receptors induce dysphoria, induce endocrine changes, and control pain at the spinal cord level. Opiates, opioids suppress coughs by blocking the activation of the cough center in the brainstem. Codeine and hydrocodone-based cough suppressants are still widely used. This would include Robitussin AC and Vicodin syrup. People will abuse these substances for the psychedelic effects. Unfortunately, an overdose of the psychedelic substance dextromethorphan can cause respiratory suppression and nausea and vomiting. Overdose of cough suppressants is usually in combination with other depressants such as alcohol, benzodiazepines, and antidepressants. Opiates, opioids are also given to control diarrhea. Opiates, opioids works on the brainstem to inhibit gastric secretions and depress the activity of the gastric muscles. Opiates, opioid addicts may suffer from severe constipation due to the suppressant of the gastric juices. Opiates, opioids affect every part of the body, but especially the heart, the lungs, the brain, the eyes, the voice box, muscles, cough center, nausea center, reproductive system, excretory system, and immune system. Physical side effects of opiates, opioids, but especially heroin, includes insensitivity to pain, lowered blood pressure, lowered pulse, lowered respiration rate, and confusion. At stronger doses, opiates, opioids, but especially heroin, might cause droopy eyelids, nodding head, slurred, slow, raspy speech, slowed coordination and walking gait, pinpoint pupils, and this is how we determine if somebody has overdosed on heroin or an opiate. We look at their pupils, and if they're pinpoint, normally when you open up somebody's eyes, even if they're unconscious, the eyes are not contracted. They're dilated to some extent. But when somebody is on when somebody is on an opiate or an opioid, it contracts the pupil to the point that it's almost invisible. And that's what we're talking about with pinpoint pupils. Histamine release causing itchy, dried skin, suppression of the cough center, hindering the clearance of phlegm, vomiting due to the activation of the nausea center, severe constipation, delayed menstruation, reduced testosterone production in males, and dull sexual desire to the point of indifference. And this is one of the reasons why, sure, you can have a crack whore, somebody that has sex for so that they can get crack, But having somebody prostitute themselves when they're a heroin addict is nigh on to impossible. It reduces testosterone levels. It makes them non-functional as sex is concerned. Tolerance for opioids occurs when the body tries to neutralize, the toxin. It does this by speeding up metabolism, especially in the liver, desensitizing the nerve cells that the substance affects, increasing drug excretions by increasing urine, feces, and sweat output, alteration of the body chemistry to compensate for the effects of the drug. Opioids tolerance is very rapid, and the individual might multiply their dosage 10 times in 10 days to get the same effect. And for this reason, there's a lot of different reasons why people who are heroin addicts or using opioids, why it really screws everything up. They do not seem normal. Their whole body reacts to the heroin. Chronic use of opioids can cause permanent changes in the brain. Animal studies show that the heavy usage of opioids will reduce the dopamine-producing cells in the ventral tegmental area by 1/4. Hence, these individuals have less of an ability to feel pleasure or even feel normal, another reason to take the drug. At this point, the body relies on the drug to feel normal. Withdrawal from opioids may take place in 3 stages. The acute withdrawal phase, the body tries to return to normal too quickly. The post-acute withdrawal, subtle emotional and physical symptoms such as mood swings and sleep problems that may persist for 3 to 18 months after use of the drug. Protracted withdrawal, more severe emotional and severe symptoms that may start after the first month and last into the 30th week. Decrease in blood pressure, decreased body temperature, decreased respiration, feeling of general uneasiness. This reaction might be triggered by environmental cues that incite memories of their addictive life. These cues can persist for decades after cessation of use. Short-acting opioids, 2 to 3 hours, result in more acute withdrawal symptoms that may begin 8 to 12 hours after chronic use. This would include heroin, morphine, and Dilaudid. Withdrawal peaks at 48 hours and lasts for 5 to 7 days. Long-acting opioids will delay the withdrawal symptoms for 1.5 to 3 days. That would include methadone and LAAM. Peak withdrawal hits at the 4th to the 6th day, and recovery may take as long as 2 weeks. Opioids that resemble codeine have a withdrawal pattern that is somewhere between the short and the long term opioids. Codeine, oxycodone, and propoxyphene, that's OxyContin and Darvon. One of the curious withdrawal symptoms of opioids is hyperactivity. This is caused by a sudden release of an excess amount of norepinephrine. Norepinephrine release is inhibited by the opioids. All in all, people rarely die from opioids withdrawal as they may do with alcohol or sedative hypnotic withdrawals. The results are similar to a severe case of the flu. The problem with opioids withdrawal is the fear of the withdrawal, since this is the area of the brain that is mostly affected by the drugs. Neonatal effects of opioids usage are extreme because the drug readily crosses the placental barrier. Pregnant opioid users are at greater risk for miscarriage, placental separation, premature labor, and breech birth, stillbirth, and eclampsia. Eclampsia is a toxic high blood pressure. As I told you, my great niece had a son who was, when she was shooting up with heroin, she shot up through her whole pregnancy, and it was really touch and go as far as the baby was concerned. The baby is, he's in the 4th or 5th grade now, and he has rage issues that go well beyond anything you can possibly imagine. If the fetus survives these dangers, it will be just as addicted at birth as the mother is, though due to size and dilution factors, the withdrawal symptoms are more severe. Low birth weight, high-pitched cry, irritability, tremors, exaggerated reflexes, diarrhea, rapid breathing, sweating, vomiting, sneezing, yawning, hiccuping. If the neonate survives the withdrawals, the effects will last 5 to 8 weeks, and it took him 6 weeks to get over his heroin addiction. In the early 21st century, 4,000 to 5,000 people died from opioid overdoses every year. Last year, 130 people died from opioid overdoses every day. 47,450 people. 14 million drug-related emergency room visits occurred in 2017 related to opioid overdoses. In one study, only 57% of the opioids were accidental. In other words, the people were trying to overdose. What opioid overdoses look like: blood pressure drops, the heart isn't beating rapidly enough to circulate blood. Because the heart isn't beating, the lungs fill up with fluid resembling drowning. The lips turn blue as the hue begins to imbue the entire body. The pupils become pinpoint. Respiration begins to rasp and rattle. They go into convulsions as much from the lack of oxygen as from the toxins. Luckily, I missed this. The opioid problem started about 2001. And in 2000 is when I left medicine, so I missed this whole thing. I have seen them, but not to the level that people that work in emergency rooms today see these problems. Tony Hawkins, drummer for the Foo Fighters, he overdosed on opioids, benzodiazepines, tricyclics, and THC. This was last year. Juice WRLD, he's a rapper. He overdosed on Percocet. Chyna, the pro wrestler, she overdosed on oxycodone, oxymorphone, temazepam, and diazepam. And Corey Monteith, he was an actor and a singer, I guess. He was on Glee. He overdosed on heroin and alcohol. Death by overdose is one way to die from opioids. Another is to contract a disease from sharing needles. According to research, 50 to 90% of IV heroin users carry the hepatitis C virus. A look at individuals who have only shut up for a year shows a rate of 71.4%. 20 to 40% of those infected will develop liver disease. 4 to 16% will develop liver cancer. 50% of all IV drug users are HIV positive. But 25% of all U.S. HIV/AIDS cases were transmitted from the contaminated IV drug users. 3/4 of these individuals are male. 7 to 10% of the HIV/AIDS cases in the United States are transmitted through sexual contact with heterosexual or homosexual IV drug users. 70% of children with HIV had mothers who were IV drug users or the sexual partners of individuals who were IV drug users. IV drug abusers will do just about anything to get their fix. Heroin fairly quickly scleroses the veins being used for injecting, so the individual has to go to more and more difficult sites for their fix. The wrist, for example, between the toes, in the neck, even the dorsal vein in the penis is used by individuals to shoot up with heroin. Heroin users may inject themselves 6 times a day, and sanitation is rarely the top priority for them. Septic abscesses and soft tissue ulcerations are often the result of unsanitary practices. Because the individual is immunocompromised by the drugs being used, the severity of the infections are sometimes catastrophic. This includes infections of Staph aureus and Beta strep group A. There are several conditions that are more common among IV drug users than non-users. Necrotizing fasciitis is a condition where a virulent bacteria gets under the skin and eats tissue away. Endocarditis, bacterial infection of the heart valves. cotton fever, short-term bacterial infection. This is necrotizing fasciitis. That's what it looks like. Welcome to my world. 58% of the people entering treatment for heroin addiction have been injecting the drug. Drug usage tends to start. This is dried up. This is actually dried up. That can be raw, and that's what I have seen in my time. Drug usage tends to start at different ages. The mean age for first alcohol usage is 16.4. The mean age of first tobacco usage is 17.3. The mean age of first marijuana usage is 17.4. The mean age of first heroin usage is 22.2. From first usage to daily habit averages about 1 year of sporadic usage. Research following a group of 582 heroin abusers for 33 years with an average starting age of 23.4 found that after 33 years, more than half were dead, 50 to 100 times greater than the general population. They died from overdose, accidental poisoning, homicide, suicide, accident, and liver disease. 44% of the ones who were still alive still used heroin. 67% used tobacco. 22% were daily alcohol abusers. 35.5% used marijuana. 19.4% used cocaine. 10.3% used crack. 11.6% used amphetamines. The group reported high rates of mental health and health problems. The group that now averaged 57.4 years reported frequent interactions with the criminal justice system. There's a shock for you. Morphine is metabolized by the liver. 3 to 6 times the morphine must be ingested to get the same effect as an individual gets from an injection. Morphine will be detectable in urine for several days after ingestion. 1 out of every 6 Americans has a chronic pain problem due to arthritis, back injury, cancer, burns, severe tissue damage, or severe nerve damage. Some medical facilities spend over 1/3 of their appointment time dealing with chronic pain issues. In one research of chronic pain sufferers, 72% had suffered for more than 3 years and 34% suffered more than 10 years. From this research, about half were afraid to use opioids, muscle relaxants, or sedative hypnotics because fear of tissue dependence and addiction, fear that the painkiller would mask more serious diseases, fear that they might be thought of as a drug seeker trying to supply a habit. Risk factors in morphine addiction includes kidney and liver problems, drug abuse history, medical drug usage, mental health history, hereditary factors that make the patient more susceptible. Codeine is used for cough suppression. As a cough suppressant, it is a Schedule II drug, and when it is mixed with another drug for pain control, it is a Schedule III drug. Codeine was the most widely prescribed and abused opiate in the United States. Its #1 ranking has since been taken over by Vicodin. Pimp C and DJ Screw died from cough syrup overdoses. They drank cough syrup for the psychedelic effect. They both died on the dance floor, so there you go. They died dancing. They're both rappers. Hydrocodone is also known as Vicodin, Hycodan, Tucson, and Norco. This is a Schedule III drug. 120 million prescriptions were written for Vicodin in 2006. Abuse of this drug usually is precipitated after the drug has been prescribed legally. Heavy abuse has been known to cause hearing loss. 600 deaths a year are caused from hydrocodone overdose, usually when the narcotic is used with other depressants. Methadone, Darvon, and Demerol were developed in German laboratories during World War II, and the Axis powers were cut off from their supply of opium to provide painkillers of similar caliber to morphine. Methadone is less powerful than morphine and lasts longer in the individual's system. Methadone is authorized in the United States as a treatment for heroin addiction. There are 1,292 methadone treatment programs in the United States with 228,000 heroin addicts. Hydromorphone is refined from morphine and gram for gram is 7 to 10 times more potent than morphine. Because of its potency, hydromorphone is stringently controlled. That's Dilaudid. Oxycodone is a semi-synthetic derivative of codeine. It's used for moderate to severe pain. This drug is supposed to be taken orally. The effects begin after about 30 minutes. The effects last for about 4 to 6 hours. It is a stronger drug than codeine, but weaker than both morphine or Dilaudid. This drug can be abused by chewing or crushing and injecting or sniffing the resulting drug. The manufacturer of the drug has tried controlling abuse by reducing strength of the tablets. Other names for oxycodone are Percodan and OxyContin. Meperidine, Demerol, Pethidine, or Meperidine I know it is Demerol, of course, has been around longer than most of the synthetics and semi-synthetics. It is 1/6 the strength of morphine, but is widely used as an injectable anesthetic. In large doses, Demerol can cause sedation and euphoria, which makes it ideal for surgery because it doesn't suppress coughing or have the side effects of constipation. This drug is the most widely abused by medical professionals. Toluen is a weak opioid antagonist as well as an agonist. When used in combination with other antihistamines, the drug is reputed to give a heroin-like high. Manufacturers have mixed the drug with naloxone, the opioid antagonist, to reduce its use as an opioid accelerant. This drug is rarely used now to get high. Propoxyphene is also called Darvon, Darvocet, Propocet, and Wyjezek. It is used for mild to moderate pain relief. This drug metabolizes slowly and so can lead to overdose or addiction if not monitored. The drug is sometimes used as a replacement opioid for heroin treatment in place of methadone. Only 4% of overdose deaths using opioids have been seen with propoxyphene. Fentanyl was the most powerful of the opioids as it is 50 to 100 times stronger than morphine. It is used pre and post surgery to alleviate excessive pain. It also now comes in a patch for chronic severe pain and in a lollipop. There is also an oral transmucosal tablet called Actic, meant to be dissolved in the mouth. Street chemists have been able to replicate the structure of fentanyl with a powerful drug called China White. Unfortunately, some of the street drug contains MPTP, which kills the dopamine producing cells in the brain, resulting in Parkinson's disease at best and at worst, a frozen addict who can't move for the rest of their lives. Fentanyl overdose deaths. Prince died of a fentanyl overdose. He actually died twice. He was on a plane that landed in right outside in Moline, Illinois, which is right down the road from where I live. Strangely enough, he died on the plane. They brought him back, and a couple days later, he was found dead in his apartment in Minneapolis. Tom Petty died of an overdose death. He actually had 3 different types of fentanyl in his system. Michelle McNamara, who's married to this guy, and he's the famous one. She was a writer. She died of a fentanyl overdose death. Mac Miller, who is a rapper, died of an overdose of fentanyl, cocaine, and alcohol. And Lil Peep, who is also a rapper, died of an overdose of fentanyl and Xanax. As if fentanyl wasn't strong enough and it wasn't killing off enough people, the Food and Drug Administration has approved Suvia, which is 10 times stronger than fentanyl and 1,000 times stronger than morphine. The drug is so strong that coming in contact with its dust from manufacture can cause an instant overdose. Disuvia. LAAM is a long-acting opioid that is used for heroin replacement therapy. LAAM lasts for 2 to 3 days, whereas methadone lasts for only 1 to 2 days. Because it only has to be taken every third day, take-home doses are unnecessary, as is the case with methadone. LAAM metabolizes in the system too slowly for the drug to be used for pain management. LAAM is more tightly controlled than methadone, and despite its success as treating heroin addicts, the paperwork involved makes it an unattractive alternative than the more widely used methadone. Naloxone and naltrexone are opioid antagonists blocking all the exogenous and endogenous opioids. These drugs can be given to people who have overdosed on opioids, blocking the deadly effects of the opioid structure. Unfortunately, naloxone is short-acting and has to be frequently administered to block the deadly effects of the opioid chemical. Naltrexone blocks the effects of the opioid for up to 72 hours to help prevent relapse. Buprenorphine is a powerful opioid agonist at low doses, but at high doses becomes an opioid antagonist. At low doses, it is used as an analgesic substitute for morphine. It is 50 times stronger than heroin. At high doses, it has an inverse agonistic effect and will block opioids from receptor sites for up to 30 hours. At high doses, it can be used as part of an opioid treatment regimen because it blocks the effect of the opioids while taking the edge from some of the side effects. Clonidine is often used to diminish nausea, anxiety, and diarrhea from opioid withdrawal symptoms. It also reduces opioid craving. It reduces the overactivity of norepinephrine receptors and can cut withdrawal time in half. Used in conjunction with naltrexone, clonidine can reduce withdrawal recovery for 1 month to 5 days. Stadol and Ultram are new synthetic opioids developed as less abusable or addictive analgesics. These drugs are still abused and have been classified as a Schedule IV drug. Sedative hypnotics are any drug that relaxes and soothes the body and the mind. The sedatives eases anxiety or induces sleep, and these are the hypnotics. The two main categories are benzodiazepines and barbiturates. Benzodiazepines include alprazolam, also known as Xanax, and clonazepam, which is also known as Klonopin. The barbiturates include the phenobarbital as an example. The barbitals are barbiturates. Just under half of all prescriptions for psychiatric medications are written for antidepressants. The first sedatives were bromides, also used as anticonvulsants in the 1850s. The biggest problem with these drugs was the fact that they had a long half-life, so toxic levels could build up in the body. Around the American Civil War, chloral hydrate started being used as a sleep aid and a sedative. It was used to treat tension, pain, insomnia caused by alcoholism, and pregnancy neuroses. It was used as the original Mickey Finn to knock out men so they could be shanghaied. This is chloral hydrate. In 1882, physicians began using formaldehyde to control alcohol withdrawal symptoms. It is still sometimes used to treat alcohol withdrawal symptoms despite addictive properties and unpleasant odor. Barbiturates were first developed at the end of the 19th century, and their popularity peaked in the 1930s and 1940s. Barbiturates are any compound synthesized from barbituric acid, pentobarbital, secobarbital, and phenobarbital. These substances are highly addictive and fairly toxic, making them fairly dangerous. Miltown or meprobamate was used fairly extensively as a sedative in the late 1940s into the 1950s. It became popular with housewives and came to be known as Mother's Little Helper. And of course, back in the 1960s. The Rolling Stones sang a song about Mother's Little Helper, and this is what they were talking about. Less dangerous than barbiturates, it maintained its popularity until the 1960s when benzodiazepines were developed. Glutathione, Doradin, was also used as a barbiturate substitute. Unfortunately, it was weaker than phenobarbital. It was just as addictive as barbiturates. It is no longer manufactured in the United States. Librium, I'm not going to, chlordiazepoxide, was the first benzodiazepine developed in 1954. Along with diazepam, Valium, these two drugs dominated the sedative hypnotic market until the invention of Prozac. As a matter of fact, when I was in the military and we were dealing with women that were depressed about their husbands being overseas in Vietnam, we gave out Librium and Valium by the bucket load. We used to get all the medications in gallon containers, but for Valium and Librium, we got them in 5-gallon buckets. Thought to be a good alternative to the highly addictive barbiturates, benzodiazepines proved to be very addictive themselves, with just as dangerous withdrawals as barbiturates. Today, there are several new drugs that are being advertised as less addictive: Lunesta, Buspar, Rosarim, Ambien, Lyrica. Only Buspar and Rosarim have proven to be less addictive. Sedative hypnotics proved to be so addictive that their use waxed and waned over the years. At this point in time, benzodiazepines are used sparingly, and they have been replaced by psychiatric medications that are less addictive, and there is a lower possibility of adding them to other medications to get a high. However, sedative hypnotics can still be abused if the drug is overused when prescribed by a physician. It is used in combination with other psychoactive substances for the synergistic or the counteractive effect. The drugs are borrowed or stolen from someone as a form of self-medication. The drugs are obtained by other illegal means, for example, forged prescription or buying on the black market. The list of celebrities who died from barbiturate overdoses is long. Marilyn Monroe had high doses of Nembutal and chloral hydrate in her system when she died. Dorothy Dandridge had high levels of tricyclic antidepressant imipramine, also known as Tofranil, when she was found. Jimi Hendrix was a notorious mixer of drugs. Hendrix had high levels of secobarbital in his system when he asphyxiated on his own vomit. The drugs were prescribed to his girlfriend. Bruce Lee, the quintessential martial arts expert, died from an allergic reaction to a painkiller containing aspirin and meprobamate. Freddie Prinze shot himself while under the influence of Quaaludes. Prinze was the star of the hit sitcom Chico and the Man. Elvis Presley was a notorious prescription pill mixer. When he died, he had 14 different drugs in his system, including codeine, Quaaludes, and methaqualone. Keith Moon was a drummer for The Who and an alcoholic when he tried to clean up. The drug he was using was a sedative, clomethiazole. He had 10 times the daily dosage in his system when he died. Abbie Hoffman was a 60s anti-war activist. Hoffman was found with 150 tabs of phenobarbital in his stomach. His death was ruled a suicide. Steve Clark was the lead guitarist for Def Leppard. Clark was found by his girlfriend with respiratory failure from the use of painkillers, Valium, antidepressants, and alcohol. Margot Hemingway was an actress and the granddaughter of the iconic author Ernest Hemingway. Granddaughter Hemingway was found dead from an overdose of phenobarbital on the 35th anniversary of her grandfather's suicide. Rob Pilates of Milli Vanilli died of a heart attack induced by a sedative given to him to help with alcohol withdrawals. He was taking the drug with alcohol. Dana Plato, the actress from the sitcom Different Strokes, died from a mixture of Soma, which is a muscle relaxant, and Vicodin. Plato had a long history of prescription drug abuse. Old Dirty Bastard, the lightning rod of the rapper band Wu-Tang Clan, died after mixing tramadol, which is a painkiller, with cocaine. Chris Penn, an actor and brother of Sean Penn, died from a mixture of promethazine, which is an antihistamine, and codeine. The combination mixed with obesity created a fatal enlargement of his heart. You may remember Chris Penn from not Dirty Dancing, the one with Kevin Bacon. Wait a minute. I can't think of the name. R&B singer Gerald Levert died from a combination of Percocet, Vicodin, Darvocet, Xanax, and 2 antihistamines. Anna Nicole Smith, the blousy blonde and Playboy bunny from Texas who shocked the world by marrying a one-foot-in-the-grave billionaire, died with 11 drugs in her system, including Ativan, Cirax, Klonopin, chloral hydrate, Lexapro, Valium, Noctec, and Zoloft. Posthumous Academy Award winner Heath Ledger died with 6 drugs in his system: oxycodone, hydrocodone, Xanax, Valium, doxylamine, and temazepam. Michael Jackson had a number of drugs in his system when he died, but the combination that killed him were propofol, lorazepam, midazolam, and Valium. Officially, Corey Haim died of pneumonia, but the actor had been fighting drug addiction most of his adult life. He was found unresponsive with lethal doses of Valium, Vicodin, Soma, and haloperidol in his system. Amy Winehouse was a notorious drug experimenter who went through rehab several times before her death at 27. She had started several episodes of binge drinking and then abstaining before her death. She died of alcohol poisoning with a alcohol level of 0.416 in her system. Whitney Houston had been a notorious drug mixer most of her adult life. She was found drowned in her bathtub with high levels of cocaine, Flexeril, Benadryl, Xanax, and marijuana. Judy Garland had been a child star and had started a pattern of excessive workdays fueled by uppers and downers. By 47, she died of a secobarbital overdose. Philip Seymour Hoffman was a highly touted actor, nominated for 4 Academy Awards, of which he won once. He died at 46 from an overdose of heroin, cocaine, amphetamines, and benzodiazepines. Tom Petty was a rocker for 4 decades. He died at 66 with 3 forms of fentanyl in his system, along with oxycodone and 3 types of benzodiazepines. Kurt Cobain was the iconic frontman for the alternative rock band Nirvana. While Cobain died of a shotgun blast, he had excessive amounts of heroin and Valium in his system when he died at 27. Jim Morrison was the lead singer for the San Francisco band The Doors. Morrison considered himself a poet and philosopher as well as a singer. Morrison died of a heroin overdose in his bathtub at age 27. Janis Joplin was a rock star from the late 60s and early 70s. She partied with such iconic figures as the Grateful Dead and Country Joe and the Fish. She died at 27 of a heroin overdose. Prince was a singer and songwriter from 1980 until his death in 2016. His album Purple Rain is one of the most celebrated albums of the last 50 years. He died of a fentanyl overdose at age 57. John Belushi was one of the major original players on Saturday Night Live. He played Joliet Jake Blues of the Blues Brothers. In 1982, Belushi overdosed on a speedball at 33. River Phoenix was a child actor from the late 80s and was headed for success. The star of Stand By Me, Indiana Jones and the Last Crusade, and Sneakers, he died of a speedball overdose outside a club in LA at age 23. Chris Farley was a comedian of Saturday Night Live fame. He starred in such movies as Tommy Boy and Beverly Hills Ninja. He died of a speedball overdose at 33, like his hero, John Belushi. At present, benzodiazepines are the most widely used sedative hypnotics in the United States. Benzodiazepines vary in their half-lives and can cause tissue dependence. For this reason, they can be highly addictive with severe withdrawal symptoms. Most physicians only use benzodiazepines as a short-term fix for specific conditions. In order of usage, the most widely prescribed benzodiazepines are alprazolam, Xanax, 34 million prescriptions, lorazepam, Ativan, 19 million prescriptions, clondiazepam, Klonopin, 16.7 million prescriptions, diazepam, Valium, 12 million prescriptions, and temazepam, Restoril, 7.6 million prescriptions. Benzodiazepines are used to reduce symptoms of anxiety and panic disorders, reduce anxiety and apprehension in surgical patients, treat sleeping problems, control skeletal muscle spasms, control seizures, dampen acute alcohol withdrawal symptoms. Side effects of benzodiazepine usage is very similar to alcohol. Benzodiazepines are most often abused in conjunction with other drugs, as they are used to lessen the effects of withdrawal symptoms, methamphetamines, cocaine, and heroin. In one study, 100% of benzodiazepine addicts were addicted to other substances as well. The typical benzodiazepine abuser is a white, well-educated 30-plus female. Benzodiazepines work because they increase the effects of the inhibiting neurotransmitter GABA in the cerebellum, the cerebral cortex, and the limbic system. The stronger influence of GABA inhibits anxiety-producing thoughts and overstimulation of neural messages. Benzodiazepines are metabolized by the liver to produce more powerful metabolites. The original drug and the metabolites tend to stay in the body for an extended period of time because they are extremely fat soluble. Alprazolam, or Xanax, is used for generalized anxiety disorder, panic disorder, and depression. Triazolam halcyon is used for short-term treatment of insomnia, 7 to 10 days. Diazepam Valium is used for anxiety, skeletal muscle spasms, control of seizures. IV Valium is used as a sedative before surgery. Tolerance has to do with liver efficiency. Older individuals will have a stronger reaction than a younger person. Overdose of benzodiazepines can cause dementia-like symptoms in the elderly. Tissue dependence can occur with excessive use over several months, or normal dosage over a year. Because of the drug's lipophilic properties, even small doses over time can cause tissue dependence and addiction. Withdrawal from benzodiazepines can be severe and take several months to taper off from the drug. Symptoms include recurrence of original symptoms, magnification of symptoms, exaggeration of the recurrence of symptoms, true withdrawal caused by low GABA and excess epinephrine and norepinephrine. Onset of withdrawal begins after 1 day with short-acting benzodiazepines and lasts for 7 to 20 days. For long-acting benzodiazepines, withdrawal begins after 5 days and takes up to 28 days for the symptoms to subside. Rohypnol is a benzodiazepine that causes short-term memory loss and sedation. The drug has been used for short-term memory impairment and has been used as a date rape drug since the 1970s. Rohypnol has been banned in the United States along with GHB since 1996 because of its use as a date rape drug. Buspar is commonly prescribed as an anxiolytic and in combination with an SSRI to treat depression. Buspar does not increase GABA. This drug does not seem to cause addiction and is rarely abused. This drug cannot be used to treat seizures. Buspar acts as a SSRI, and for that reason, but it doesn't affect serotonin, and for that reason, sometimes individuals who are having sexual side effects of SSRIs are given Buspar uh, to uh, uh, to change the level of serotonin in their system, which allows them to have a sex drive. Lunesta is a hypnotic drug prescribed for insomnia. The drug increases GABA production, leading to relaxation. This substance is only addictive when taken with another drug. Placidil and chloral hydrate is actually a chemical ether. Chloral hydrate is actually 3 molecules of ethyl alcohol fused together. Both these drugs are prescribed to induce sleep and have a long history of addictive use and toxic overdose. GHB is a rapid sleep inducer. GHB increases the body's level of growth hormone, HGH. Its effects are sedation, disinhibition, empathy, sensory enhancement, and euphoria. It lasts for about 3 to 6 hours. GBL and BD drugs are metabolized into GHB. These two substances have been formulated into mint-flavored rave elixirs, Blue Nitro, Revivrant, Gamma G, Rimforce, and Insom X. Quaaludes effects are similar to those caused by alcohol and linger for 60 to 90 minutes. The sedating effect lasts for 6 to 10 hours. This is a drug that is often abused in South Africa. Strangely enough, Quaaludes are the favorite drug used in South Africa. Lyrica, this drug is used to treat nerve pain from the shingles or diabetes and can be part of a seizure treatment as an anticonvulsant. More recently, it has been used for the treatment of anxiety, sleep, and mood disorders. This substance is rarely abused alone. Razarim activates melatonin receptors in the brain. Melatonin is a substance that helps maintain the circadian rhythm. Used for short-term treatment only, when taken with alcohol, the result can be toxic. These 3 drugs, Zaloplan, Zopiclone, and Zolpidem, are known as the Z hypnotics. These drugs are short-acting drugs, 1 to 4 hour half-lives. Excess use will cause nausea, headaches, diarrhea, and drowsiness. These drugs are rarely abused except with other drugs. And that is it. And so I will talk to you, not next week, I think the week after. This is the 6th week, so that will be maybe after spring break. So I'll talk to you guys later.